Hi, I'm Dr. Raghu Athre with Athré Facial Aesthetics. The purpose of this talk is to discuss multi-dimensional facial rejuvenation. When I say facial rejuvenation, for the purposes of this talk, I'm really going to determine the facial rejuvenation of the mid-face and the lower one-third of the face. Now, some of the modalities that can be used in this area are facelifting, and there's different types of facelifts, which are, I've shot many videos here on Real Self about mini lifts and full facelifts. However, when we actually take a look at what causes facial aging, it's actually a multi-dimensional type of problem. Number one, there have been studies to show that we actually lose volume of the bone of our skulls. Number two, we lose volume of some of the connective tissues. Number three, we lose collagen. Number four, we lose some of the tensile strength of the tissues of the face. And last but not least, our skin also ends up taking the brunt of some of the environmental damage, and we lose some of the quality of our skin. Now, it is true that by doing a facelift, we're able to resuspend all of these tissues, and in some ways we can also recreate some of this volume depending on how the facelift is performed. In my specific technique for facelifting, whether it be a mini lift or a full facelift, I end up giving the patient a little bit of a mid-face lift, which recreates some of the volume of the mid-face while tightening the jowls, jaw, and the neck. However, in many patients, we really should be using what I call a multi-dimensional approach to target each one of those above-mentioned criteria that causes the facial aging. Though we can add small amounts of volume simply from the lifting, most patients really do need additional amount of volume, especially in the mid-face region, along the upper jaw, maxillary region, maybe a little bit around the lips, and sometimes even along the angle of the mandible and along the malar eminences. We can use fillers such as Restylane and Juvederm, or even longer acting fillers such as Radiesse. Well, a very interesting new methodology has been microsomal fat injections for these areas. Fat grafting has existed for a long period of time. However, some of the problems with fat grafting include lumpy bumpiness, as well as a very short, indefinite time frame with respect to longevity. The liposomal fat grafting, also called as the ALMI, capital ALMI procedure, which combines liposomal fat with PRP in a proprietary technology, allows you to inject the fat through much smaller gauge needles into areas such as the under eye, the maxilla, the smile lines, the jawline, places like that, with minimal amounts of bruising, while adding volume that could last upwards of 5 years. This is another pronged attack on that problem of facial aging. Some of the other things that I think that we should address also during facial rejuvenation is the quality of the skin. Some of the easy treatments for this include skincare, but at the time of facelifting, I truly believe that we should address the skin with some better treatments such as deep chemical peels or laser facial resurfacing. This multi-dimensional attack at facial rejuvenation, volume addition with liposomal fat, structural facelifting with addressing the superficial skin, is truly what is necessary to give the patient an excellent, amazing result with long longevity that actually looks natural and makes the patient look rejuvenated. For more information on my multi-dimensional facial rejuvenation, please contact us at www.Athré Facial Plastics, Dr. Raghu Athre, MD, Athré Facial Aesthetics.